So treatment for ankle sprains or sinus tarsi, especially chronic ankle sprains, is much like the other treatment here. We start with the IFC machine plus a heat pack for about 10 to 12 minutes. Once that's finished, we will do some ART and some soft tissue work right into the actual ankle, and we'll dig this in here. We start with some Graston, which is this little tool I use to scrape the tissue down, get everything loosened up. The goal of this treatment is to loosen the ankle up so when the adjustment happens, it moves smoothly. So we go in there with the Graston, work this up. It's usually pretty painful and I can find the nodules. Once that's done, we get the shockwave machine. The shockwave is a pneumatic gun with a bolt and a tube that goes back and forth. And essentially when I run the gun, I'm gonna have to bring it up here and down here. It's pretty light on my model, but this is really, really painful sometimes when you do it. I get into the bracket in here, I try to get around the sinus tarsi, I get everything moving in there. Okay, so the rest of that treatment was to basically get this ankle super loose so we can adjust it. So what we do is get the patient on her back, get her foot jammed on the table here, hold the table. I take the ankle here, I get everything else to stiffen up on her so she doesn't move on the table, and get this foot to relax. And then I take the ankle and I just pull like that. When it moves, it's one of the greatest feelings in the world for me because I know the patient's gonna stand up right after the first time and be substantially better and be able to move their foot. And you'd be surprised, more than not, that happens after the very first treatment when we treat sinus tarsi.